Good afternoon, ladies and gentlemen. Thank you so much for joining us here on M42's main stage here at the inaugural Abu Dhabi Global Healthcare Week. And we've had such a fantastic morning, panel discussions, inspirational talks, and we are continuing with this high-level, thought-provoking panels. To welcome you on stage now, I'm going to bring my co-host, that's what I'm calling her, Dr. Fatima Redden, who's a Senior VP Clinical Development M42. I like to call her the brains of the program. She's scheduled many of the speakers, knows them very individually. This particular session is very exciting. I know we're pressed for time, but very quickly, we're talking about navigating the future, women leaders in healthcare and AI. Fascinating.
That's an exciting topic, yeah? Do you want to take place with us?
I will certainly join you for a photograph at the end and listen in very carefully. We're going to open it up to our wonderful audience online here as well, women and maybe some questions from some men. So without further ado, let's introduce our wonderful cast list. Sophia El-Makhtri, the Deputy Chief Operating Officer, M42, and Acting CEO, Mubadala Health, Dubai. Miriam El-Dahari, the Executive VP, Group Procurement, M42.
Dr. Maya Al-Jaber, CEO of Imperial College London, please. And Dr. Layla Abdelwarith, our Chief Executive Officer of an NRL. Thank you.
And ladies, take it away.
Thank you so much. I'm extremely honored. I'm extremely excited to have you on board. Welcome on board, everyone. Thank you so much for joining us today. Healthcare and women's. What's the percentage of women in our healthcare? Any number? 30, 40, 50? What's the percentage in M42? 70%, 64. Okay, the last number from our human capital is 64. We're extremely happy and honored by the leadership support to have a lot of these women empowered within the organization, and that's an example. We have with us M42 women's leaders. Let's navigate together the future. One or two questions we're going together. Then the first question will be for our four speakers. My first question will be, how is AI, let's say, improving, optimizing, how is AI amazing, how is revolutionizing the healthcare practice? Each one of you is having an area of expertise. So let's hear from you, how is AI impacting your work? Now, how are you planning for the future for AI within your area of expertise? Let's start with Safia. Safia is the Deputy COO in M42 and is the CEO of Mubadala Health Dubai.
Thank you, Dr. Fatma. I think, first of all, to really applaud the efforts of M42, the group, to promoting women and empowering women in leadership and across all levels of the organization, especially in healthcare as an industry where technical knowledge sometimes is required, the training programs that we have, the empowerment to receive on-the-job training. And I'm humbled also to be one of these recipients of these opportunities. So something really to be proud of. Now, going back to your question about AI and how it's revolutionizing the world. So the way I think about it, there are two areas. First of all, AI is touching everywhere, everything, in terms of optimizing decision, automating tasks that do not necessarily need human intervention, things that do not add value, and we spend so much time on it. So I see opportunity, and we've already seen AI impacting automation, optimizing resources. I'm sure my fellow colleagues here will talk more about how it's optimizing their day-to-day operations. Specifically in healthcare, AI has made strides in terms of decision support, how we implemented it in clinical decisions. So the M42 platform, the AI platform, which during the Global Healthcare Week, we announced that we received version 2 of it, or launched version 2. This is an AI tool that allows physicians to access medical information and revolutionize how they're making decisions around medical concerns. And of course, the Genome Project, the use of AI in analyzing and the data analytics around the UAE genome, the Emirati population genomics, the data that will come out of this is invaluable. So if I stay and talk about it, I'll probably take the whole session, so I'll leave it at that.
We'll come back in the next conference again. Thank you so much, Safia. Mariam Al-Zahiri, how is AI revolutionizing your area of expertise, procurement? Tell us.
I think what we see today, Dr. Fatma, is a friction of the capabilities that are going to exist in the next upcoming years. I truly believe that just like AI is touching each and every one of us on a personal level, it is also touching us from operational level and at all aspects and in each and every sector. And it's quite important to understand the magnitude of what is going to happen or what we can achieve through AI. Within supply chain in particular, or within procurement in particular, I think the idea of knowing what is coming your way, the idea of being able to predict the future is something really key in planning demand. And I think one of the most important things that you need as a physician or you need as a patient is knowing that everything you're going to need, whether it is to have supplies for your surgeries or the availability of medication if you're going for treatment, all of that is going to be available thanks to AI, because AI can predict the volumes needed, can plan demand accordingly, and can tell you also what is going to be out of stock soon, if there are any global shortages, if anything is affecting the supply chain globally, not only within the UAE. So that helps you to plan things way better. So I think the idea of being able to predict what's coming is revolutionary on its own.
Thank you, Mariam. Dr. Mai, AI and healthcare. Can you tell us in ACLDC and in your practice, how is AI revolutionizing your area?
Sure, thank you, Dr. Fatma, and good afternoon all. I'm glad to be in this panel with my colleagues, the leaders in M42 leadership. In fact, our presence here reflect the leadership vision of inclusivity, diversity, and considering women perspective in healthcare decision. Now, talking about AI in healthcare, in fact, when it comes to healthcare, artificial intelligence is more of augmented intelligence. Sorry. It's more of augmented intelligence, I would call it, which is mainly about providing the healthcare professional with the tech tools that enable them to make better decisions when it comes to patient care. Moving forward, AI is the route for personalized recommendation. One size fits all is no longer the practice. With AI and utilizing the available data, creating the required AI algorithm, it will help the physician and the healthcare professionals detecting diseases at an earlier stages, more accurately, more efficiently. And this will lead to the wanted outcome, which is the proven or improving the health quality of the patients and reducing cost in the long run. AI tools as well can help individuals and people identifying their own health risk. And here comes the individualized recommendation or the individualized care that it was one of the main topics discussed in this summit. With AI tools as well, what we can do is the remote monitoring and giving the healthcare professional with the telemedicine solutions that enable providing care outside the traditional clinical setting. And especially this will benefit managing the chronic disease, patient with a chronic disease, and remote monitoring and offering the telemedicine. This will improve the outcome. So with considering all the benefits of AI tools, what is essential at the time of implementing the AI tools is to consider the ethical implementation of AI tools, transparency, and which is very important, is the patient privacy and safety. And I believe to be able to deliver AI tools in healthcare, a collaborative efforts between the AI experts, between the healthcare professionals, between the payers and stakeholders is essential to be able to provide the equitable access to this transformative technologies.
Looks amazing. Can I ask you one more question and jump on accessibility? As a women leaders, okay, how are you going, in fact, to optimize women's access, in fact, to care through the AI, as an example?
Well, I believe utilizing AI tools and access, as Safiya as well mentioned, improving the operational efficiency. It will not only improve access for women, it will improve access for patients in general. But again, using AI tools when it comes to women health, it's a very vast field, and there are a lot of AI tools that now tailored to improve the women health and improve the access of women to the needed care, especially when it comes to remote areas, for example, and considering remote telemedicine. This will improve definitely the health of women having difficulty in accessing the needed care.
Thank you so much, Dr. Mai. Dr. Laila, how is AI revolutionizing your area?
Thank you very much, Dr. Fatma, and thank you all for joining us today.
Dr. Laila, can I ask you?
So my field is pathology and laboratory medicine, and we have very exciting applications of AI in pathology and laboratory medicine. We started off, like Safiya mentioned, by automating regular tasks, so screening, scanning patient information, doing simple tasks like auto verification, supervised AI applications. But the exciting ones now is with the machine learning and the application on digital pathology. So we can scan the slides, we can teach the machine to recognize certain patterns. For example, in the tissue, which could be, for example, cancer or a particular pathology, and they can scan these slides very quickly and identify them very quickly to the pathologist, so enhancing the productivity and also the accuracy and the reproducibility of the diagnosis. And I think the very exciting application also is with the predictive algorithm. So we are, as pathologists, whether clinical pathologists or anatomic pathologists, are trained to like pattern recognition, yeah? So we look at CBC parameters, and from that we can say, oh, okay, this patient has iron deficiency, or this patient have hepatitis, or whatever condition that is. With AI, what we found is, you know, the more data you throw on the AI machine, the power of these predictive analytics are even beyond human computation. And then I think the previous speaker alluded to earlier that 360-degree kind of impression of that individual, not just the laboratory test, but the demographics, the age, the environment, and all of that, can predict what kind of trouble this individual is going to likely get in. And I think this is going to be a fascinating trip for us.
It is fascinating, and it's fascinating to hear about you also and from you. Then, Dr. Mai, I'm coming back to you. Okay. The next panel will be with the youth. We're going to listen in the next panel to our youth team, okay, and speaking about what's their vision on AI and on technology. Then I want from you, okay, what is the message you want to convey to the women, okay, to the young generation of women who are coming? I think in Arab Health, you told us that it was challenging for you, okay, to become a physician, Emirati physician, and then a leader. What's the message you want to convey to the women, the young women who are coming on the field?
Well, Dr. Fatma, I think the opportunities that the youth are having right now is completely different than what we had in my time. So my advice for the youth is to grab every opportunity and to learn and to educate themselves and to get exposed to all the updates and, for example, the AI technology, especially attending. I am so excited to see a lot of youth and the young generation attending the summit, this is a great platform for them to get exposed, to learn, to get connected as well with the healthcare sector. So for the youth generation, I think the chances they have at this time and the support they are having from the government, from the leader, is a great opportunity.
Thank you so much. Safia, AI and leadership, how it is serving the leadership actually, okay, to grab the AI?
So this is, I think, the opportunities, as my colleagues have mentioned, are immense. There's a vast majority or a vast scope for application of AI across the board, whether it is, as I mentioned, in the decision making or in the healthcare industry itself. We announced multiple opportunities during the Abu Dhabi Global Healthcare Week surrounding, for example, the biobank. And what the biobank does is it stores stem cells and biological samples. So the field of research on these samples and the application of AI into the biobank or into the genome project is tremendous. I want to touch on what you mentioned regarding women's health and accessibility.
True.
You know, this field, unfortunately, from the studies that I've came across from scholars that we've looked into their studies, are either mostly in the West or done on male population.
True.
So there are specific diseases and conditions that are related to women that have not yet been researched well. So the opportunities for use of AI across samples that are collected, blood samples that are collected for the genome project, or through the biobank, or through the machine language operating system that will look at across millions and billions of data points, gives us an opportunity to really open the field for women's health, accessibility, directing drug formulation towards this segment.
True.
So, as I said, opportunities are massive in this field.
Great opportunities.
Yes.
Mariam, how can we empower the next women's generation, the next UAE women's generation using the AI?
I think there are multiple aspects or there are multiple tools that could be used to broaden your knowledge. I think having access to information is something key. I don't think we had the same archives, the same I would say the same opportunities when we were young. I think access to information is quite important, and the young generation today have very, very easy access to information. And I think, and not only access to information, but access also to verified information, being able to tap into all of these researches done all over the world, being able to hear and see and listen, whether through social media, AI, whatsoever. There are tools nowadays that were not available during our time. And I think being able to access these tools and use them wisely is something that is this generation that is very blessed with. And I think what I would advise them to do is to use the access they've got today in their benefit and towards improving their lifestyle, improving their careers, improving their social status, and help to make it something that is part of their day-to-day life.
Grabbing opportunities. I love it. Thank you so much. Dr. Laila, for women in healthcare and technology and AI, how friendly they need to use it? I know that you are an amazing mentor. What do you want to tell them?
Actually, I have a confession. I am the worst when it comes to AI.
It's good to hear about
AI
it.
applications, I have to say. And I always, envy my brother, who is a very AI savvy and just, learn very quickly. For me, I have to, get the instructions and then apply them. but my advice would be to embrace it, absolutely, because it's the present and the future. Educate yourself and really get to know and try it. It's fun to apply it and to learn. It's a great enabler. And the whole tools behind it and the whole analytics also would require your insights and so on into it as well. So I think it's a bidirectional relationship, because we can contribute also to the intelligence of the AI.
Absolutely. And ask your brother for help, as Dr.
Yes,
Laila is
absolutely.
doing. Let me ask our audience, do you have any question to our amazing leaders? Please.
Hi, good afternoon. Thank you, Dr. Fatma, for moderating this amazing panelists. And thank you for our amazing speakers for just presenting like great examples in the women healthcare leadership. I just have two questions. The first one related to Mrs. Sophia. Yeah, okay, one. I just want to ask you about what the areas do you believe that we need to focus in healthcare for women, as you have mentioned, that they are not still searched, because like as a woman, we know that we have some women health or women disease that just specifically to women. For example, we have endocrinal disease, obscene disease, and we have, for example, the autoimmune disease. And which area do you believe that it's very important for the research and the biotech to start working in this area? Thank you so much.
Thank you so much. This is a great question. I think any women-related disease. Yesterday we had Dr. Louise, who's an expert in menopause. So this is an important area for all women. Of course, breast cancer and is another important area. I'll give you an example of why it's important and how the use of AI, genomics, the combination of all of this have changed the course of how we look at it. So the initial pilot study that Cleveland Clinic Abu Dhabi has launched on the genome program looked at a sample of Emirati women for the genome mutations related to the breast cancer. And we discovered through this initial study that the usual test or screening woman has to undergo. Right now, the protocol says when a woman reaches 40 years old, she needs to start undergoing breast cancer screening. However, this study showed that within the Emirati population, women have a higher, unfortunately, prevalence of breast cancer, and they need to start their screening, which means the protocol now has shifted to 33 years old. So this is a specific group of Emirati women in a specific disease. So across all the metrics, we need to be focusing and doing further research, because what this does, or in this example of the breast cancer under the Genome Project, we manage hopefully, inshallah, to save lives of women who would go otherwise undetected and potentially, have to suffer in later stages of cancer. I hope this answers your question.
I'm so sorry. Okay, I would like to stay with you and with them for the next hour, or even 2-3 hours. I promise that we will having next session, the next conference, and maybe on a focus on. I hope that you are grasping the technology. I hope that you are convinced with our M42 women's in leadership. AI is here. AI is staying, AI is today, AI is tomorrow, but our M42 women in leadership are grabbing the technology. We're on it, you're on it. Please, let's move all together. Thank you so much. Thank you.
Thank you so much, Dr. Fatma. And we can't possibly allow our wonderful panelists to leave the stage without a photograph. First of all, our panelists, please do get a photograph, and then I will, of course, join you as well. A fascinating discussion. I know that this morning we have been pressured for time, so we haven't had a chance to open it up to as many audience questions as we would love to. but I can vouch that all these women are super approachable, so to get them afterwards. May I also get a photograph as well? Dr. Fatima. Yes. If people are shy, I'm going to definitely not be shy. Please, please come. And where's Fatima? Fatima, please, please. Cecilia, where are our representatives? I hope you don't mind the discrimination that's going on here, but we are allowed this moment in the spotlight. Just the ladies. Everyone your best side? Ladies and gentlemen, another round of applause to our wonderful panelists. We are back in 2 minutes with a wonderful signing. Thank you.